CEN Passing Score. Question 1. A patient at 34 weeks gestation presents with vaginal bleeding and abdominal pain. What is the priority nursing action? Option A. Assess fetal heart rate. Option B. Obtain maternal vital signs. Option C. Prepare for emergency delivery. Option D. Perform a pelvic examination. The correct answer is option B. Obtain maternal vital signs. The ABCs and maternal stabilization are the priority. Vaginal bleeding in the third trimester may be from placental abruption or placenta previa. Maternal vital signs indicate hemodynamic stability. Fetal heart rate, A, is important but secondary to maternal status. Pelvic exam, D, is contraindicated until placenta previa is ruled out. Question 2. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A. Perform a 12-lead ECG. Option B. Obtain vital signs. Option C. Administer aspirin. Option D. Assess the chest pain. The correct answer is option B. Obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Question 3. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A. Sudden, severe thunderclap headache. Option B. Gradual onset of confusion. Option C. Focal weakness on one side. Option D. Loss of consciousness without headache. The correct answer is option A. Sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which of the following ECG findings is most consistent with pericarditis? Option A. ST-segment elevation in all leads with reciprocal depression. Option B. Diffuse ST-segment elevation with PR-segment depression. Option C. ST-segment elevation in contiguous leads with reciprocal changes. Option D. Pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B. Diffuse ST-segment elevation with PR-segment depression. Acute pericarditis classically presents with diffuse, global, ST-segment elevation across most leads along with PR-segment depression. The ST-segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 5. A patient presents with acute onset of severe, tearing chest pain radiating to the back. Blood pressure is 160/90 mmHg in the right arm and 110/70 mmHg in the left arm. What is the priority nursing intervention? Option A. Administer 4 morphine for pain. Option B. Obtain a 12-lead ECG. Option C. Administer 4 beta- blockers to reduce heart rate and blood pressure. Option D. Prepare for stat CT angiography. The correct answer is option C. Administer 4 beta- blockers to reduce heart rate and blood pressure. This patient's presentation, tearing chest pain radiating to the back with unequal blood pressures, is classic for acute aortic dissection. The priority medical intervention is rapid reduction of heart rate and blood pressure to decrease aortic wall stress and prevent propagation of the dissection. Beta- blockers, example esmolol, are the first line agents. While pain management, A, is important, it is secondary to hemodynamic control. ECG, B, is appropriate but does not address the life-threatening process. CT angiography, D, is diagnostic but is performed after stabilization. Question 6. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A. Palliative care begins with the initial diagnosis and continues through the end of life. Option B. The patient cannot change their end-of-life decisions once enrolled in hospice. Option C. There is an important legal distinction between withholding care and withdrawing care. Option D. A living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker. Question 7. A patient presents with acute urinary retention. The nurse anticipates the need for Option A. Foley catheter insertion. Option B. Straight catheterization. Option C. Condom catheter. Option D. Suprapubic catheter insertion. The correct answer is option A. Foley catheter insertion. For acute urinary retention, insertion of a Foley catheter provides continuous drainage and allows monitoring of urine output. Straight catheterization, B, may be used, but Foley is preferred to prevent repeated catheterizations. Condom catheters, C, are for incontinence, not retention. Suprapubic catheter, D, is used when urethral catheterization is not possible. Question 8. A 12-lead ECG has been completed on a patient who presents with chest pain. The ST segment is normal. Which new finding is most critical and requires prompt intervention? Option A. Left bundle branch block. Option B. Right bundle branch block. Option C. Peaked T waves. Option D. Inverted T waves. The correct answer is option A. Left bundle branch block. New-onset left bundle branch block, LBBB, in a patient with chest pain is a critical finding that can mask acute ST-segment elevation myocardial infarction, STEMI, on ECG. The presence of new LBBB with chest pain is considered a STEMI equivalent and warrants immediate reperfusion therapy. Right bundle branch block, B, is less concerning and often benign. Peaked T waves, C, may indicate hyperkalemia but are not as immediately critical as new LBBB in this context. Inverted T waves, D, can indicate ischemia but do not necessitate the same urgent intervention as new LBBB. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with sudden onset of severe, diffuse abdominal pain that is like a knife. The patient is lying very still. This presentation is most consistent with Option A. Acute pancreatitis. Option B. Perforated ulcer. Option C. Renal colic. Option D. Bowel obstruction. The correct answer is option B. Perforated ulcer. A perforated ulcer typically presents with sudden, severe, diffuse abdominal pain described as knife-like. Patients lie perfectly still because any movement worsens peritoneal irritation. Acute pancreatitis, A, is often severe pain but more epigastric and often radiates to the back. Renal colic, C, is flank pain. Bowel obstruction, D, is cramping pain with nausea and vomiting. Question 10. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A. Administer lithium immediately. Option B. Ensure the patient is in a safe, calm environment. Option C. Restrict fluid intake to prevent water intoxication. Option D. Place the patient in seclusion. The correct answer is option B. Ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium, A, may be prescribed but administration is a provider order. Fluid intake, C, should be monitored but lithium requires adequate fluid intake. Seclusion, D, is only for imminent danger. Question 11. A patient presents with heat stroke. What is the priority nursing intervention? Option A, administer antipyretics. Option B, rapid cooling with cold water immersion. Option C, administer 4 fluids. Option D, obtain a core temperature. The correct answer is option B, rapid cooling with cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. Cold water immersion is the most effective method. Antipyretics, A, are not effective for heat stroke, as the elevated temperature is from environmental exposure, not a reset hypothalamic set point. 4 fluids, C, are important but cooling is the priority. Obtaining core temperature, D, is important but should not delay cooling. Question 12. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4 normal saline. Option B, 4 nitroglycerin. Option C, 4 morphine. Option D, 4 oxygen. The correct answer is option B, 4 nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Question 13. A patient presents with tachycardia, palpitations, and weight loss. What endocrine disorder is most likely? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, diabetes mellitus. Option D, Cushing's syndrome. The correct answer is option A, hyperthyroidism. Hyperthyroidism presents with tachycardia, palpitations, weight loss, anxiety, and heat intolerance. Hypothyroidism, B, presents with bradycardia, weight gain, and cold intolerance. Diabetes, C, presents with polyuria, polydipsia, and polyphagia. Cushing's syndrome, D, presents with weight gain, moon phases, and hypertension. Question 14. A patient with opioid use disorder presents with suspected opioid overdose. Which medication should the nurse anticipate administering? Option A, naloxone. Option B, flumazenol. Option C, naltrexone. Option D, methadone. The correct answer is option A, naloxone. Naloxone, Narcan, is a pure opioid antagonist that reverses the respiratory depression and sedation of opioid overdose. Flumazenol, B, is for benzodiazepine reversal. Naltrexone, C, is for maintenance therapy. Methadone, D, is a long-acting opioid. Question 15. A patient has a Glasgow Coma Scale, GCS, score of 7. What does this indicate? Option A. The patient is neurologically intact. Option B. The patient has a moderate brain injury. Option C. The patient has a severe brain injury. Option D. The patient is brain dead. The correct answer is option C. The patient has a severe brain injury. GCS scores are interpreted as 13-15 mild brain injury, 9-12 moderate brain injury, and 3-8 severe brain injury. A score of 7 indicates severe brain injury requiring intubation and ICU care. This patient is not intact, A, does not have moderate injury, B, and is not brain dead, D. Question 16. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. What is the most likely diagnosis? Option A, Wernicke-Korsakoff syndrome. Option B, delirium tremens. Option C, alcoholic ketoacidosis. Option D, hepatic encephalopathy. The correct answer is option A, Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome presents with the triad of confusion, ataxia, and ophthalmoplegia, caused by thiamine deficiency due to chronic alcohol use. delirium tremens, B. Presents with tremor, agitation, and hallucinations. Alcoholic ketoacidosis, C. Presents with metabolic acidosis. Hepatic encephalopathy, D. Presents with altered mental status due to liver failure. Question 17. A patient presents with signs of hypothermia. Which core temperature indicates severe hypothermia? Option A, 32 degrees Celsius. Option B, 30 degrees Celsius. Option C, 28 degrees Celsius. Option D, 26 degrees Celsius. The correct answer is option C, 28 degrees Celsius. Severe hypothermia is defined as a core temperature below 28 degrees Celsius (82.4 degrees Fahrenheit). At this temperature, the patient may be unconscious with minimal or absent vital signs. Mild hypothermia, 32-35 degrees Celsius, A. Moderate, 28-32 degrees Celsius, B. And severe, 28 degrees Celsius, C. Option D, 26 degrees Celsius, is also severe, but 28 degrees Celsius is the threshold. Question 18. A patient in atrial fibrillation with rapid ventricular response has a heart rate of 152 bpm and is hypotensive. Which intervention should the nurse anticipate? Option A, administration of 4-diltiazem. Option B, administration of 4-amiodarone. Option C, synchronized cardioversion. Option D, administration of 4-digoxin. The correct answer is option C, synchronized cardioversion. In unstable atrial fibrillation with rapid ventricular response causing hypotension, synchronized cardioversion is the immediate treatment of choice. Hemodynamic instability indicates the patient cannot tolerate the rapid rate and requires immediate electrical conversion. Chemical rate control with diltiazem, A, amiodarone, B, or digoxin, D, is appropriate for stable patients but is too slow for unstable patients.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A, return to the waiting room in line of sight of the triage nurse. Option B, resuscitation bay to prepare for intubation. Option C, isolation room on droplet precautions. Option D, isolation room on airborne precautions. The correct answer is option D, isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Question 20. A patient with cirrhosis presents with hematmesis. What is the most likely source of bleeding? Option A, peptic ulcer. Option B, esophageal varices. Option C, gastritis. Option D, a Mallory-Weiss tear. The correct answer is option B, esophageal varices. Patients with cirrhosis develop portal hypertension, leading to esophageal varices. These are fragile and prone to bleeding, causing hematmesis. While peptic ulcers, A, gastritis, C, and Mallory-Weiss tears, D, can also cause upper GI bleeding, esophageal varices are the most likely source in a patient with cirrhosis. Question 21. Which of the following is a classic sign of a hip fracture in an older adult? Option A, internal rotation of the affected leg. Option B, shortening and external rotation of the affected leg. Option C, adduction of the affected leg. Option D, flexion of the affected leg. The correct answer is option B, shortening and external rotation of the affected leg. A hip fracture typically presents with the affected leg shortened and externally rotated. The patient is unable to bear weight. Internal rotation, A, is more common in hip dislocation. Adduction, C, and flexion, D, are less specific findings. Question 22. A patient arrives with a chief complaint of the worst headache of my life. Which of the following is the priority nursing action? Option A, administer pain medication. Option B, perform a neurological assessment. Option C, prepare the patient for a CT scan. Option D, establish for access. The correct answer is option C, prepare the patient for a CT scan. Worst headache of my life is a classic presentation for subarachnoid hemorrhage. A non-contrast CT scan is the priority diagnostic test. While neuroassessment, B, is important, the CT is diagnostic and should not be delayed. Pain medication, A, and for access, D, are important but secondary to diagnosis. Question 23. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Question 24. A patient presents with nuchal rigidity, photophobia, and altered mental status. What is the priority diagnostic test? Option A, CT scan of the head. Option B, lumbar puncture. Option C, MRI of the brain. Option D, blood cultures. The correct answer is option A, CT scan of the head. While lumbar puncture, B, is diagnostic for meningitis, a CT scan of the head must be performed first to rule out increased intracranial pressure, which would make lumbar puncture dangerous. Blood cultures, D, should be obtained but after CT, MRI, C, is not the initial test. Question 25. A patient presents with a chief complaint of suicidal ideation. Which of the following questions would be a priority for the nurse to ask? Option A, do you have a plan? Option B, what medications do you take? Option C, do you live alone? Option D, have you attempted suicide before? The correct answer is option A, do you have a plan? When assessing a patient with suicidal ideation, determining if they have a specific plan, means, and intent is the priority. This directly addresses the patient's immediate risk. Other questions, B, C, D, are relevant for history but do not assess imminent risk as directly.